Hello, and this is a lovely sunny day, and it's the sort of day that makes you think about something that you could do that's really useful. That's one of those really useful days. So thinking about along those lines, I've had a chat to my furry friends who I've just taken for a walk, and something sensible that we could do, especially in dentistry, to make things a bit greener and to reduce our footprint would be a good thing to do. Hello, Wells. Have you got a hot tip for going green? What's that? Be sensible. I'm sure most of you would recognise one of these. This is a regular dental tray. It's got a random number of instruments on it, and most dental operators will have one of these to their left or to their right while they're seeing patients. Now, one of the sensible approaches we might be able to use would be to try and reduce the number of instruments that we use down to just one or two. It would mean less cluttered tray, less likely instrument knocked on the floor, and more importantly, it would reduce our carbon footprint. And also, while we're about it, try and get rid of any plastic instruments. This is a typical blank shaft of a handheld dental instrument. To get the most out of the instrument, we're going to have something that functions on both ends. On one end, we're going to place a probe, and you may think, what? A probe? Yes, we're going to put a probe, but we are going to modify it slightly so that it's more versatile. Instead of having a 90-degree angle at the bend, we're going to have a 45-degree angle, which gives you more options. We're going to shorten it fractionally, which will make it more versatile. And we're going to make it stiffer and stronger, which helps. And we're still going to keep it pointed and sharp. Probing you would carry out in your usual way, checking the surfaces for any softening, checking restorations for broken margins, etc. Where the additional benefit of this type of probe comes into play is when you want to clean the interproximal areas, especially where you're looking to see whether you've got stain or frank cavitation and you want to remove plaque and calculus. This works very well, almost like a substitute scaler, and helps you clean out that area in a very short space of time. And the stiff end of the probe is very useful at lifting your crowns, your inlays and your bridges when you're trying to fit them and they are a tight fit. If you just happen to be doing fixed appliance orthodontics, it can be very useful to have a stop in the middle of the archway. That's something this probe end is really great at doing. There you go. Just hit it with a light. Or, if you need to, you can put it on the studs on the canines or the hooks on the molars. If you have fixed appliances with your arch wire held on by ligatures, probe end is brilliant at just getting underneath, lifting them off. Underneath, lifting them off. To maximise the use of the instrument, we're going to have an attachment on the other end as well. And on the other end, we've got what looks a little bit like a paddle, but is actually a combination of a ruler, a mixing spatula, a flat plastic, and an orthodontic bracket placing tool. And as you can see, along the base, we've got 10mm markings, and along the end, we've got 4mm markings. And it's set at about 45 degrees. And if I just turn it sideways, you can see that it's a parallel-sided instrument. And we'll come back to that a little bit later. Now, when it comes to measuring things in the mouth, what I usually end up using is something like this, which is far too big, awkward, and not very comfortable for the patient. So that's why we've placed a 10mm ruler in effect on this end of the instrument. 10mm will do you for most of the things you need to measure in the mouth. For instance, gaps. How big is the gap? Is it closing? The size of teeth, are they average or too big or slightly too small? The size or the position of the screws that we may or may not like using for anchorage reinforcement. Tooth tissue loss. How much tissue has been lost from this tooth? Where do I need to position the bracket to get the teeth in the right position so that they can be restored to the correct height? You may want to measure the overjet, or you may want to measure the overbite. You may want to measure contact displacements. Very useful for mixing when you have some mixing to do. Now, also built into this end of the instrument, as well as a flat plastic and a ruler, is a bracket placing instrument. So if you look at the long axis of the blade, you can see it's parallel sided, not like a lot of other dental instruments which are tapered. That means you can place it in the slot of whichever bracket you like, an 018 or an 022. You can put the bracket where you want it, express out the composite, turn the instrument around, and then just clear up any excess you might have. Turn it back round again, pop it where you want it, lift it off. It is. You can check it if you wish using the ruler. And if you want to go round the corner, you can just use the tip of the blade rather than the base of the blade. So for the front and round the sides. Now that we've been able to combine all these functions into one instrument, let's go back to our tray. And now we can start to remove some of these instruments off the tray, especially the plastic one. Keep our mirror and replace them all with one instrument called TN10. And if you'd like to try one, please go online and contact the relevant distributors. And many thanks for watching this green video.